to the last segment of the program, which is another set of interview, and this time around we're talking health. Yesterday, of course, the world generally commemorated World Neglected Tropical Diseases Day, of course, where you have key actors within the health sector, hold a lot of activities to draw attention to some diseases that have been referred to as the diseases of the poor. Because we are informed that neglected tropical diseases are found in certain countries that have been classified as the third world countries, and particularly even within countries, these diseases are mostly found in specific areas where, of course, you have poverty, lack, and other social issues ongoing there. But to be able to shine more light and provide more information about what these diseases are and what should people do to prevent them, and what the government on their own part are doing at different levels to rein in on these diseases, we have again invited people from FCT Public Health Department to help us talk more about prevention and management of some of these diseases. And therefore it's my pleasure to introduce to us this morning on this segment. We first of all have Mrs. Lami Ndayoko, and she is the program officer, FCT Neglected Tropical Diseases Program Officer, Public Health Department. Welcome, and it's good to have you join us. Good morning. Of course, sitting very closely to her is Abba Abubakar. He is FCT Neglected Tropical Diseases Monitoring and Evaluation Officer, Public Health Department, FCT. Thank you also for joining us.
Thank you. Good morning.
All right, let's start from the start. We'll be hearing NTDs, neglected tropical diseases. Why are these diseases described as neglected and tropical? Anybody can answer.
Okay, good morning, everyone. Good morning, our viewers. From the word neglected tropical diseases, just the way you said it from the initial stage, a group of diseases that is affecting middle and low income communities, or let me say countries, and it also has to do with poor when there is a poverty, just the way you said it, and it's more prevalent, that is more common where there is poor sanitation, where there is no safe water for drinking, or the water is inadequate, or if there is poor housing condition. And this disease is a group of pathogens. It includes bacteria, virus, pathogens, and also viruses that is associated with health, social, and economic consequences. Okay. And these diseases, when you look at these diseases, it has high morbidity and disability, but it has low mortality rate. Okay. That is, the death rate as a result of this disease is low. It's very, very low
compared to others.
Okay. And these diseases, when you look at it, it's classified into two. We have preventive chemoprophylaxis, in which we use medicine for the prevention of this medicine, and we also have integrated disease management. We can also call it disease management and morbidity prevention.
Okay.
Thank you.
Madam Abba, you are the monitoring and evaluation officer.
Yes, sir.
FCT is our primary place of concern.
Yes.
How prevalent are these diseases in the FCT? If they say it's the diseases for the poor, FCT is an interesting place where you find everybody, the rich, the poor, and the ones that are nowhere to be found. So how prevalent are these diseases among FCT residents?
Yes, thank you very much. So before I go further, I think the diseases, we have about 4 NTDs prevalent in FCT.
Okay.
We have onchocerciasis, which we call river blindness.
Okay.
We have lymphatic filariasis. We have schistosomiasis, which is also called snail fever. And we have soil-transmitted helminths. Okay. So these diseases, they vary in the prevalence in FCT.
Okay.
All of the 4 diseases are prevalent in FCT. But we have 4 diseases. One of them, which is lymphatic filariasis, is endemic in 4 area councils, which include Abaji, Buari, Gwagwalada, and Kuje. So those area councils, they are at-risk communities of those lymphatic filariasis. While schistosomiasis is endemic across the whole 6 area council in the FCT. So I can say that all FCT communities are at risk because it's endemic in all the communities in the area council.
Well, we know that from statistics, they say, of course, Nigeria holds the highest number within the West African sub-region of people living with NTDs, that is neglected tropical diseases. So it's understandable why even in the FCT you still find a prevalence. But let me ask now, from the point of view of the FCT Public Health Department, are you doing anything, or you're just keeping the numbers and then you're alarming us that these diseases are prevalent in the FCT? What exactly are the things that you are doing to help us?
FCT are doing a lot of intervention in collaboration with some partners and Federal Ministry of Health.
All right.
Number one, we are doing high sensitization to all endemic communities in FCT, that is community sensitization, health education, and we are paying high-level advocacy visits to the top government officials to solicit for more support for the intervention, and also WHO are providing free medication through Federal Ministry of Health. So we are doing what we call mass administration of medicine in the whole 6 area council in the FCT for all the diseases. Which there are, I think we have about two medicines that are donated free by WHO for the whole intervention in FCT.
Okay, Mrs. Lami, he has talked about the fact that yes, FCT is not just sitting, it's doing something. Do we have health facilities that people who have symptoms or are actually suffering these diseases can go to in the FCT, and where can these facilities be found?
Like most of our diseases, that's neglected tropical diseases, in all the, since the diseases are poorest of the poor, most of the diseases are in the community, and in all the FCT communities we have primary health care situated in the community. So what we are, and we also have community distributors in the community that provide this medicine to the people that need it in the community. So they refer, if there's any case of NTD, they refer to the facility in the community. So the proximity of them going to another place does not count, because the community has the facility and they refer them to the facility where they will get their medicine. But during our MAM, the CDDs visit them in their various houses and distribute this medicine for them. But after the MAM, they visit the facility to get their medicine. And that is what we are doing for now.
So what about, is there, because she has talked about the medicines.
Yes.
Are there vaccines for some of these diseases?
Well, I think there is not any vaccine for these diseases. As she said, what we are doing mass administration of medicine.
So there are drugs, medicines, not vaccines.
It's medicine.
It's medicine. We don't call it drugs. Because that we had drugs.
Of course.
So we are giving medicine, not drugs. So what we are doing mass administration of medicine. If one person is having that diseases in community, so all the community, we consider the community at-risk community. Because let me take it like lymphatic filariasis. The common vector for this disease is mosquito.
When you say lymphatic filariasis, is this that one that someone's leg gets swollen, or elephantiasis?
That's the long-term effect. That is, if you are not taking the drugs. As she said, we have NTD. That is preventive measure. So if you are not taking the preventive measure, it will lead to disability. So that's the enlargement of the legs, or scrotum in all those ones. They are the long-term effect for the lymphatic filariasis. So we are giving medicine for all those things in the whole area council and the communities.
So you are saying that early detection and early treatment can prevent it from getting worse to where the legs start to look like that of an elephant, where the name elephantiasis came from. So but how much sensitization are you people doing? Do you wait for this day to come before you start visiting radio and TV stations to enlighten residents?
No, already we have our itinerary. So let me say, like monthly, we are doing community sensitization, health education, health talk, and also we are paying advocacy to churches, mosques, to sensitize people on these diseases. Then we are engaging all the area council chief whenever they are having meetings with their local chief and other people. We are sharing posters and flip chart to them to educate their people and sensitize them. As she said, also the health workers in all the communities, we are having flyers and other items that we give to the area council,
IC materials,
in the facility. So whenever they are coming for hospital visit, they educate those people on NTDs and other diseases. So we call it integrated health approach. So it's not that when somebody comes from malaria, you just treat malaria and allow him to go. You also call his attention on all these NTDs. In FCT.
Okay, Dr. Lami, women and children, they are mostly the ones who are found at home most of the time. And from what you have said, it's a disease that is closely associated with sanitation and other things related to the home front. What should women do, especially with respect to sanitation and all of that, in order to prevent? Because I think prevention is, they say, is better than cure. What are those tips that you can share with women who are watching us now, so that they can be able to protect themselves, their loved ones, from these these diseases?
Okay, fortunately, during our visit, whether supportive supervision or mass administration of medicine, mostly we find these women and children. And by the way, this medicine was also given to schools. We go to school to give this medicine. It's not only at the community level. We also educate women to make sure that they clean their environment. You know, because most of these diseases is also caused by mosquito and black flies. And you know, since they are bites, well, you need to clean our environment, discard all the stagnant water, make sure that we clean the bushes, and we always use mosquito nets. So because pregnant women, children are more at risk of these diseases, especially lymphatic filariasis and onchocerciasis, because they are transmitted by the bite of either black fly or female Anopheles mosquito that transmitted the lymphatic filariasis. It's a filaria worm that causes that lymphatic filariasis, and it's through mosquito bites.
Mosquito bites.
Yes.
Okay, so at all costs, we should avoid mosquitoes in our homes.
Yes.
Okay, with respect to, you've talked about that, the fact you do a lot of awareness campaigns and all of this, and when I check the list of these neglected tropical diseases, about 20 of them, the names are quite tongue-twisting, even in English language. So how do, for example, someone who is Nupe, how do you, when you go to communities like that, how do you begin to speak in the language that they understand exactly what you are saying? Because it's one thing to spend money on awareness, and then it's another thing to be able to craft the awareness messages rightly, that the people you are talking to will be able to understand what exactly you are talking about. Do you pay attention to messaging that will be communicated so that the people you are speaking to know exactly the disease that you are describing?
So as my colleagues have said, in the community settings, we are doing two treatments. We are doing treatment in the community setting, as I have said. Onchocerciasis and lymphatic filariasis.
So what is onchocerciasis?
That is what
river blindness. So on this program we have very local people who are watching. So when you say onchocerciasis, please tell us what exactly you are saying.
Unfortunately, we are not with our posters, because at the community level what we normally use is our posters. Yes, immediately when they see the posters, they will even tell you, we have a particular person that is living with this particular diseases. They might not really know the names of the diseases in English, but they were able to identify it with the use of the posters we are distributing to them at the community. Because some of the communities, once you go, even at the cheap palace, the healthcare, even at the market square, you see the posters in the community. So once you go for advocacy, they will tell you, some of them will even come close to you that, madam, I have somebody that has scrotum, that's this issue of enlargement of the chrome. They will tell you, they will now ask them, okay, please can I visit them, because we also do surgery, hydrosis surgery for those people. Well, not because of the stigma. People has it, but they don't want to come out and say we have this thing. But once they see the posters, either the person or the person that is taking care of the person will come to approach you. They will now tell you that this is what we are facing in my house. They will now direct them, refer them to a facility where they will do the surgery for them that is free.
So in addition to what you have said, as I said, in community we are training volunteers called CDD. That is community directed distributors. They are the one that are receiving the drug directly and reach and take the drug to the end user, who are the community members. And in the course of selecting those CDDs, we are selecting those CDDs from different tribes. Yoruba, Hausa, Bagi, Nufe, Igbo, all the tribes. So each person can know how to pass the message to his people. Then in the school setting as well, as I was said, we are training teachers to distribute the drugs to the or medicine to their students profils. So in also that aspect, when we train two teachers, they will train other teachers, and they will speak with different language on how to communicate with the profils and also the parent at home about the diseases. So we have a lot of communication channels that the information can reach everywhere and understand where we're heading to about the...
And even our IEC materials, we have Pidgin, we have English, we have Igbo, we have Bagi, we have Hausa, we have others.
Because messaging for me is very, very important. Very, very vital. You know, a lot of people, especially for projects, they will tell you communication. Okay, what is communication? You just go to a community, rural people, and you are speaking all the high English that they have crammed, and then at the end of the day you leave. And when they ask you, say you've completed that task. But as the monitoring and evaluation officer, kindly give us a brief on, from your evaluation experiences of the efforts that the department has been making over the years. Can you say you've been experiencing progress? Because the essence of doing evaluation, doing a project in 2023 is so that by January 2024, when you evaluate all that you have done, you should be able to say, okay, we've been able to record ABC progress.
So one of the achievements, or let me say progress of public health and NTD in particular in FCT. As I'm speaking to you now, about these 4 NTDs I'm talking about, we have already eliminated 2 NTDs in 2 area councils because of the intervention we are doing. And hopefully by next year, we are going to eliminate another 2 NTDs from the 2 area councils.
So the remaining 4, you want to take out 2?
Yes, the remaining 2. And the other one, they are already on evaluation stage. What I mean by evaluation, after mass administration of medicine for 6 consecutive years. That is, if we have give drugs for 6 years, we are going for evaluation, which we call assessment. So we have already done what we call transmission assessment survey in some area council. And after the assessment survey, we didn't find a single positive sample from the communities. So meanwhile, we have effective treatment in those communities. They are no longer disease is no longer of public health important in those communities. So by next year, we are hoping to eliminate lymphatic filariasis in FCT. Also onchocerciasis, which I call river blindness. We're also on assessment stage now, what we call entomological assessment survey. That is to go and collect the vector, which we call black fly, and do some assessment in the lab to see whether if he's still having those parasites on his body.
That it can transmit to
another person.
And also we did what we call epidemiological evaluation survey, which is involving collecting a blood sample from the community members to check whether if the parasite is still in their system. So all those processes, they are already on the process. So honestly, FCT, they are doing a lot of work for the evaluation of all these diseases.
Dr. Lami, what are some of the challenges confronting the department, particularly with respect to this project on eliminating NTDs in the entire territory? What are some of the challenges? Don't mention funding. We already know that one.
Most of the challenges at the community level, you find out that these children are taking this medicine, but yet they're still going back
to
to
the
their
source.
activity. So we have to look for the root cause and destroy the vector. That is one of the challenges, because it's like reoccurrence, re-emergence of a particular
which
infection.
makes it look like you are not doing anything.
Yes. So we have to look for other strategies apart from the MAM, that's administration of medicine, mass administration of medicine. We also have to look at other strategies to make sure that these people, especially we have to do health promotion, continuous health promotion and sensitization at the community. You understand? We also have to do a lot of work that has to do with the healthcare workers, and also we have to collaborate with the schools in the endemic communities. Because now we are not going to look at the diseases. We are going to look at where the diseases is more, people more at risk in that diseases. So we are going to look at those community and look for a strategy that will make us to get more people not having these diseases. So the strategies I said is the occurrence of these diseases while taking this medication, but because most of the time, especially schistosomiasis is more common in children, especially senior fever, that's terminal hematuria, that's urination of blood or stool. You understand? So you find out that when you have given them the medicine, they still go back to the water. The stagnant water they used to swim, especially during heat period, and also activities of washing and other things in the water, because it's during the water that the infected smell now penetrate through their skin and go to their intestine, the liver or the bladder. So when they go to the bladder, when they are urinating, they urinate blood. So even when you take the sample of these children or the people that are infected with these diseases, you find that the urine is not is with blood. So when you take the sample, you find out that they have these diseases in them, and even after treating them, they still go back to that same source. So you have to the root cause. You have to eliminate the root cause of the. I think it's one of the biggest challenges. Yes.
So that means infrastructure provision. So that people can have easy access to potable water.
Yes.
Because in the first place, if people can have access to potable water, there will be no need going to go and swim in dirty.
To promote wash.
Yes. Because I was going to ask about that. That do you have that also? Because as public health department, I know that you should be able to collaborate with FCT Rural Water Supply and Sanitation Agency. Is that collaboration active?
So honestly, we have, let me say, a very strong and active collaboration with Rural Water Sanitation and Hygiene Agency for the FCT. So our partners and FCT, they have a very strong collaboration in providing alternative water source instead of going to the rivers, like digging of these local boreholes in the communities. And we are going to communities wherever they have boreholes and it was not functioning to repair all those boreholes. As of last year, I think we rehabilitated about 100 boreholes in FCT. And we also provide new boreholes in some communities across the 6 area council so as to promote wash. Because if we can observe wash, whatever we are doing to wash our hand, do all those activities, we are protecting the intake of parasites or whatever to our system. So promote wash is one of the most important aspects of NTD.
How about schools? You go to public schools and they don't have a functional toilet. They don't have functional, what they call, is it latrines? Most public schools and even FCT are guilty of that.
Yes, exactly.
What exactly are you doing in that regard? Because it's one thing to have them in the communities, it's another thing to have them in schools. Because if you look at it, students spend a lot of hours in schools during school period.
Yes, exactly. So we are also sensitizing school on ODK. That is often defecation. Providing alternative toilet to them. There is some toilet that I think Rwasa used to construct in the school. And also from our own site, we are constructing a local tab which we call Tiffy tab. So whatever they are doing after getting in contact with feces or whatsoever, they come and wash their hand before doing anything. Even if the school don't have that water, so we are providing that alternative local tap for hand washing activities and other things. I think even last year we construct that local tap in about 26 schools in Abadi Area Council, and we're still repeating it this year.
Okay, Dr. Lami, because we're coming to the end of this section, but I will have to ask, culture plays a very crucial role in the way people behave and perceive the world they live in. How has culture, especially some cultural practices, there are communities where, for example, this elephantiasis, they don't look at it from health perspective, rather they see they have some stories around it. How have you been confronting these beliefs so that your effort will not look as if you're not doing anything?
Okay, just the way he said, we're doing a lot of sensitization. During our sensitization, we bring out those people that have all these diseases. We told them that some of them will tell you they are witchcrafts from their village that pursue them. So we make them to understand that it's not spiritual. It's as a result of a particular diseases. And diseases, this is how, because at times you have to explain the diseases. You have to explain how the disease is being transmitted. You have to explain the root cause of these diseases for them to, that belief, that superstition belief to go out of them. If not, they keep on saying it's somebody that give them the put them the disease. So it's a serious supernatural issue, but we are able to tackle it because most of them we have contact with them because they are not many, they are very few. So we used to bring them down, educate them. That is the issue of awareness. Because if people were not aware of a particular disease, nobody want to believe that diseases, it is caused as a result of a pathogen or as a result of parasite. They believe it is man-hunt. So once you make that information, sensitization and awareness, you educate them about a particular disease, that particular disease that they are suffering, I think it will go a long way.
So finally, you have last words for those watching us regarding NTDs in the FCT?
So all what we want is to, as we are here, we are to create awareness and also sensitize the general public on neglected tubercular diseases. We are facing a lot of challenges in the course of our activities. That's like high rate of refusals in some communities and schools. So what we are urging the general public,
even schools,
schools, we have a lot of fearing that when you take the drugs to the school, that you shouldn't allow, they don't allow their children to take the drugs. And at the end, they go and spend hundreds of thousands for the treatment of the same disease that if you allow your children to take
have
that
early treatment.
You understand? So both community and school were urging parents to allow their children when this program started, when we were distributing this drug, they should allow them to take the drug. It's free and not any side effect or no any long-term effect that they are thinking that they are bringing drug to stop us from being bad. All those negative perceptions.
And it's only once in a year. Once you take it in a year, you won't take it again till another year. Unlike other deworming medicine that you're taking it either 3 months or 6 months.
I have a success story last year. I said it yesterday. In one of the community, when our volunteers are doing their work for distributing these drugs, when they go to one of the households, the mother chased them out, and that her child is suffering with eye problems for the first year, and she spent a lot of money going to hospital. She didn't get it right. At the end, thank God for the health worker, they sensitize the mother, educate her, do a lot of things. She allowed that child to swallow those drugs. By evening, she called that health worker, please come and see, a live worm is coming out from from his eyes. So that's the work of the medicines. So if I didn't know, she didn't, in fact, he's about to go blind. Irreversible blindness. So we have a lot of these cases that you can see a child passing blood in his urine, and the mother or the father cannot allow him to take these drugs. I have another one that complaining about this blood in a urine. When they address him to my office, I made him and administer drugs to him. After 24 hours, he just called me, thanking God and thanking me that the things stop naturally.
So how about those who believe more in prayer? rather take their children to churches and mosques.
They should combine two things, prayers and medication.
Okay.
They shouldn't rely on prayers only.
Okay.
Pray and also act. You cannot just sit down and be praying while God provide a way for you to get problem for your medicine for all the problems you are having. So that's my own belief. Prayers and also go and ask people that know.
Okay.
Don't just sit down.
Dr. Lami, you have final words?
My final word is all the stakeholders in FCT, that's including our IPs, water,
who are IPs?
Implementing partners, and Ministry of Water and Sanitation, Ministry of Agriculture, Women Affairs, Ministry of Environment. We should come together as one and fight towards this eradication of NTD in Nigeria. And that, I think that is the way out. We have to integrate.
Integration of critical stakeholders is crucial. And of course, from our own end here, we'll continue to amplify all the messages, especially those who hold on to the belief that when they hear about vaccination or they hear about government program that is meant to give medicines to their children or themselves, they begin to, bring up all sorts of insinuations. Well, someone made an example. His man is about 55 years old. He said when they started the vaccination for polio way back then, a lot of people said if they take it, it will lead to infertility and all of that. And he said, to the glory of God, I have 27 children at the age of 55, and I'm still here. And he says if you have a new wife, he's still really ready to produce more. So that now puts lie to all those insinuations that if you take those vaccines or drugs, or medicines rather, it will lead to some of these things. These are just insinuations. Public health officers are here. You've heard from them. We hope that you take heed and do the right thing. Prevention, in any language, is far better than cure. We hope that you've been able to pick this very vital information today and you will run with it. And on this note, I have to thank you both very sincerely for making it to ASU Morning today.
Most welcome.
Thank you, sir.
Thank you, Dr. Lamin Dayako. She is from the FCT Public Health Department, and of course, she is the FCT Neglected Tropical Diseases Program Officer. Thank you for coming.
Thank you.
And of course, Madam Abba Abubakar rather, he is FCT Neglected Tropical Diseases Monitoring and Evaluation Officer, Public Health Department of the FCT. Thank you very much both once again for coming. We hope that you will keep coming, not just when it is these days, because it's very important, really. Great. So, dear listener, viewer, we sincerely thank you for investing your time with us this morning on ASU Morning. My name is Usman Khatun Umar, and I urge you to keep a date and join us tomorrow morning on ASU Morning one more time. Do enjoy the rest of the day. Bye for now.